So tell us who you are, Dr. Alansad.
Well, my name's Red Alansad. I'm a solo urogynecologic surgeon here in Laguna Beach, California. I've been here over a decade. My practice is mostly vaginal and pelvic surgery. I'm a pelvic surgeon. But we also do a lot of non-surgical procedures in my practice. My practice is about 95% doing cosmetic genital surgery.
So what are the short and long-term effects of female genital mutilation?
Some of the short-term effects would be pain from surgery, bleeding complications, infections, and psychological damage to the young lady who's received the surgery. Those are some of the short-term ones. Immediate, long-term results, sometimes you can't differentiate. Long-term ones could be just psychological damage to the lady or the young girl, feeling like she's not normal.
Clinically speaking, what does female genital mutilation serve? In other words, does it accomplish what the social mores say it will?
Well, that depends on cultures where they're done. Medically speaking, I don't think it accomplishes any medical benefits. It doesn't reduce infections. It doesn't cure anything. It just causes a lot of complications and short and long-term discomfort and pain. So when you ask me, does it have any benefits medically? I can't think of any. Socially and culturally, it may have some benefits for the women if they have to live in that particular culture, but only in that particular culture. Perhaps once they leave that neighborhood, that area, and they move to another area, they move to a more westernized society, there is really no benefit that I can personally see in having female genital mutilation.
Have you ever personally seen an instance of female genital mutilation? And have you ever treated a patient who has had this happen to them?
In my practice, I've had a few female patients who've had female genital mutilation. The most common that I've seen are the type 1s, or in simple English, is the removal of the clitoral hood or the clitoris itself, the tip of the clitoris itself. But I don't see the advanced ones where they've shown the vagina completely shut. So here in America, specifically in California, we see a few of them, but not a great deal, like in, let's say, Cairo, Egypt, where I have a friend whose 100% practice is repairing female genital mutilation. He's come to my meetings and given talks on these, and his everyday work is female genital mutilation. There's that many number of patients in Egypt and in Northern Africa.
Do you know if female genital mutilation is actually performed in the United States, or is it something that's just performed overseas?
If it's being done in the United States, it's being done covertly in private clinics and being coded in a different way, like they'll code it for vaginal repair or some type of vaginal surgery code. But no, in the United States, it's not well known in doing so, and I believe there are probably a few being done, but I can't document it. No one will report it because it's pretty much illegal.
So Dr. Alansad, for women who have had this procedure done on them, what do you suggest that they do to get help?
Good question. I think there are two ways you have to approach it. One, get it fixed medically, surgically. So find the best pelvic surgeon you can find, whether it's a gynecologic oncologist, a urogynecologist, or even a plastic surgeon who specializes perhaps in sex changes. Those are the type of surgeons you want to search and seek out and see what their experience is. So number one, you correct it medically, but perhaps just as important, I think, is that you get counseling or some kind of help in dealing with the situation so that there's no guilt involved, and so there is normal interpersonal relationships going forward with whoever the partner is. So I think you have to hit it both ways. You can't just fix the defect. You've got to fix the mind and the interpersonal relationship too.
Thank you for being here, Dr. Alansad.